Hi, we're going to talk a little bit more about neurogenic inflammation as we did on previous videos. I'm Dr. Giudice at ApolloHealth, and I believe one of the more overlooked things in care of patients with chronic pain or pain that hasn't gone away with like traditional rehab type of systems is in this concept of neurogenic inflammation, where these superficial nerves of the body get inflamed and they don't have a dampening mechanism. These nerves start to swell, create an acidy environment, and then they don't glide through the tissue as well and become pain-generating structures, ultimately affecting the whole region as well as the opposite side cortex, because that side has the map of that area in the body, and you get what's called neurological smudging, meaning you start to lose proprioception or fine motor control in this area just because it's been there a long time. And now we're not talking it has to be there 20 years for this to happen. This occurs in months. So when we look at our matrix of brain-body biochemistry, kind of where does this fall? Does it fall in the body or does it fall in the brain? I mean, we traditionally want to put this in the body category, but as we do some of these treatments, we're going to affect parts of the body like these peripheral nerves and soft tissues, but it will affect the cortex as well, and that's part of the process by which we have to balance out the triangle here. We talked previously about using a topical gel, and we talked about using low-level laser therapy to impact these nerves positively, and those are great, but we're always looking for what's best. So the Stimpod is an electric device. It uses electroacoustic waves. It is not like a TENS unit or a muscle stim unit. It's a completely different type of wave. So what happens is we've got this probe here where we can get on very specifically a nerve. So we've been talking about axillary nerve here for shoulder pain because it's super common, where we can get right on those nerves, and either you're on the nerve or you're not, right? So we're gonna feel it go down the nerve here. So we're gonna treat most of these nerves for 5 minutes, and what's cool about this is we can find the nerve located and just have the patient hold it on there, right? So it's pretty efficient to use. And we've got protocols that we use for knee pain. So for knee pain, commonly some of the nerves that are affected are going to be the femoral nerve, which go right down over the patella and the tendons, and then we have above the knee on the inside called the saphenous nerve, and that's a big one. That one's often overlooked. But we have also treatment protocols for neuropathy as well as migraine. So for migraine, again, remember we talked about before these CGR pain, substance P, inflaming these nerves. We can get right on those nerves right back here. For radiculopathy as well, whether that's like a carpal tunnel or radial nerve entrapment or ulnar nerve entrapment, we can get right on those nerves. I realize those aren't small peripheral nerves, but they're treating nerves just the same. We've got sciatica as well. We can get right on the sciatic nerve. We can get on the branches of the sciatic nerve, whether it's the tibial or the peroneal, and trigeminal nerve as well. So a lot of times people get face pain or some sort of palsy or weakness, whether it's trigeminal nerve or whether it's facial nerve, we can get right on those branches of there. So it's a great tool to have in the office in both neurogenic inflammation as well as other types of injuries.